How long should you last in bed? Have you ever wondered what the normal duration of sex really is? Have you ever compared yourself to what you think other men are doing? Do you feel like you should last longer? Or maybe you're not sure if what you're experiencing is actually normal. Is there a minimum time? Is there an ideal time? Is longer always better? And most importantly, what really defines a satisfying sexual experience from a medical perspective? If you've ever asked yourself any of these questions, you're not alone. In fact, this is one of the most common concerns among men of all ages, and yet it is surrounded by misinformation, unrealistic expectations, and a significant amount of pressure. I'm Dr. César Noval Font, plastic surgeon and medical director of Clínica NF, with clinics in Spain, Miami, and Mexico. We specialize in penile enlargement procedures, including lengthening and girth enhancement, as well as gender affirmation surgery. On our Spanish YouTube channel, we have reached millions of people by helping them understand their bodies with clarity, honesty, and a strictly medical approach. This English channel has been created with the same purpose: to help you understand your body, improve your sexual health, and make informed decisions without myths, without pressure, and without misinformation. Now, to answer the question of how long you should last in bed, we need to begin by redefining the question itself, because the way most people think about this topic is already incorrect. Sex is not a timed performance. It is not a competition. It is not something that can be measured only in minutes. And yet, many men approach it exactly like that. They think in terms of duration, comparison, and expectations. They believe that lasting longer automatically means performing better, and that shorter duration means failure. From a medical perspective, this is not accurate. When we talk about duration in sexual activity, we are usually referring to a concept called intravaginal ejaculatory latency time, which is the time between penetration and ejaculation. Studies that have analyzed this parameter across different populations have shown that the average duration typically ranges between approximately 3 to 7 minutes. This means that what many men consider too short is often completely within the normal range. However, here is where the problem begins. Most men are not comparing themselves to medical data. They are comparing themselves to unrealistic standards, often influenced by pornography, social narratives, or exaggerated stories. In these contexts, duration is often portrayed as something that should last indefinitely, without interruption, without variability, and without any form of difficulty. This creates a distorted perception of what is normal. The result is that many men who are actually within a normal physiological range begin to perceive themselves as inadequate. And this perception alone can be enough to create a problem. Because once performance becomes something you evaluate instead of something you experience, your body responds differently. To understand what an ideal duration really means, we need to move away from numbers and focus on function. The goal of sexual activity is not to reach a specific number of minutes. The goal is to maintain a level of control, comfort, and mutual satisfaction. From a clinical perspective, the concept of premature ejaculation is not defined strictly by time, but by lack of control and distress. If ejaculation occurs sooner than desired repeatedly and causes frustration or affects the relationship, then it becomes a clinical issue. But if a man ejaculates within a few minutes and both partners are satisfied, then there is no medical problem. This distinction is essential because it shifts the focus from duration to control. Control means the ability to regulate your response, to adapt to the situation, and to maintain confidence in your body. Now, let's go deeper into the physiology behind this. Ejaculation is a complex reflex that involves the central nervous system, peripheral nerves, and muscular contractions. It is influenced by both psychological and biological factors. There are men who naturally have a higher level of sensitivity, which means their threshold for ejaculation is lower. This is not a defect, it is a variation. At the same time, psychological factors such as anxiety, anticipation, or excessive focus on performance can accelerate this reflex. The more you think about when you are going to ejaculate, the more you activate the mechanisms that lead to it. This is one of the paradoxes of male sexual function. Trying to control ejaculation through conscious effort often produces the opposite effect. Now, another important aspect to consider is arousal progression. Sexual response is not linear. It evolves through stages. If stimulation increases too quickly without adequate regulation, the body reaches the point of no return faster. Many men unintentionally accelerate their own response by focusing exclusively on high intensity stimulation without modulation. Learning to recognize and regulate arousal is one of the most important skills in improving sexual performance. But again, we need to be very clear. Improving does not mean extending duration indefinitely. It means achieving a balance where you feel in control and satisfied. Now, what happens when a man feels that he is not lasting long enough? The first reaction is usually concern, the second is comparison, and the third is pressure. This sequence is extremely important because it creates a feedback loop. Concern leads to monitoring. Monitoring leads to anxiety. Anxiety leads to reduced control. And reduced control confirms the original concern. This loop can develop very quickly, sometimes after just a few experiences. And once it is established, the problem is no longer purely physiological, it becomes psychological. In clinical practice, we see many men who initially had no real issue, but who developed performance anxiety after interpreting normal variability as a problem. This is why education is so important, because understanding what is normal allows you to remove unnecessary pressure. Now, let's address another key question. Is longer always better? The answer is no. In fact, excessively prolonged sexual activity can also become problematic. It can lead to discomfort, reduced sensitivity, and even frustration for both partners. Sexual satisfaction is not determined by duration alone. It depends on multiple factors, including communication, connection, stimulation, and emotional engagement. Reducing everything to time is an oversimplification. At the same time, there are situations where duration is genuinely too short and requires attention. If ejaculation consistently occurs within a very short time frame, such as under 1 minute, and this creates distress or dissatisfaction, then it may fall within the category of premature ejaculation. In these cases, it is important to understand that there are medical and therapeutic approaches that can help. But again, the goal is not to reach an arbitrary number. The goal is to improve control and confidence. Now, what can you do if you want to improve your control and feel more secure about your performance? First, you need to change your mindset. You need to stop thinking in terms of time and start thinking in terms of awareness. Your body gives you signals as arousal increases. Learning to recognize these signals allows you to regulate your response. Second, you need to reduce performance pressure. Sexual activity is not something you pass or fail. The more you treat it as a test, the more your body will respond with tension instead of relaxation. Third, you need to develop better control over stimulation. This does not mean avoiding stimulation, but rather modulating it, slowing down, changing rhythm, and allowing arousal to fluctuate instead of constantly increasing. Fourth, you need to consider your overall health. Sleep, stress levels, physical activity, and mental state all influence sexual function. And finally, you need to avoid the most common mistake: trying to fix the problem by forcing control. Control in sexual function is not imposed, it is developed. It comes from understanding, not from pressure. Now, let me leave you with one final idea. The question is not how long you should last. The real question is whether you feel in control, confident, and connected during the experience, because that is what truly defines healthy sexual function.
If you found this explanation useful, subscribe to the channel. Here, we approach male sexual health from a medical and professional perspective, helping you understand your body and improve your quality of life without myths, without misinformation, and without unnecessary pressure.